The Government of Meghalaya had started something called the Rescue Mission and the Mother Program in the year 2018, when our Honorable Chief Minister had made it a mission to reduce the maternal and infant deaths in the state as a broader umbrella of improving the livelihoods of people in the state. So Meghalaya is having a very high rate of maternal death as well as a significant number of infant deaths.
There's always a congestion and then so many patients, and then most of the staff, the doctors, the specialists, the nurses, they are overworked. So that kind of a quality of service which you would like our patient to get, we will not be able to give because of the reason that it is overloaded, it's overcrowded.
Meghalaya has a challenge of having 7,000 villages, so the communities are dispersed. So it is important to reach out to everyone proactively and not wait for everyone to come to the health facility all the time. So we have a system of ASHAs, we have a system of ANMs, we have subcentres to reach out. But that alone cannot solve the entire issue of maternal deaths. We have taken a lot of efforts under Chief Minister's Safe Motherhood scheme, and we have significantly brought down the maternal deaths also in due course. But to bring to a very sustainable development goal number of 80 per 1 lakh birth, we need to strengthen what is called as our first referral units.
See, if you convert all the CHC into the first referral unit, we can bring all the services, especially MCH, maternal and child health services, closer to the community. People from far-flung area, they don't need to come up to Ganesh Das, up to Joai, up to Tura MCH to avail these services, which can be easily made available in this upgradation of the FRU.
When we have identified these gaps, so together with the department like Principal Secretary, our Commissioner and Secretary and us, together we have sat together and then we have thought about this one. So we saw that really there is a need for specialists. We have attributed this fact that we have less specialized doctors, like especially for maternal and child health, in terms of obs and gynae doctors, in terms of anesthetists and sonologists.
For that to happen, we have to train doctors. So as an arrangement, we thought about it and we discussed at the national level, there is a policy to train the medical officers in these three matters, which is CEmOC, Comprehensive Emergency Obstetric Care, Ultrasonography, and third is Life Saving Anaesthetic Skills. So we had put out kind of a call for within our health systems who are interested to take up these courses. So we had the first batch of 31 doctors who were interested to do this. So where should we send them? That was the next question. How do we send them? Where do we send them? So we thought of exploring states. We had gone to a few states to understand how the systems were. We thought Tamil Nadu was very good in terms of having a good training capacity, and they have done extremely well in terms of maternal and infant care. The number of medical colleges, number of training capacities was much better, and they were very proactive in terms of when we requested for some trainings. That was one of the main reasons why we chose. And we also have a better people from our state have been to Chennai and been to understanding is also little on the familiarity is also on the higher side. So we thought we'll make that possible.
We got a letter instructions from our Principal Secretary to Government, Health and Family Welfare, to impart the training to those who are really interested, that is the doctors serving in the Government of Meghalaya.
So when you want to really improve the maternal mortality as a nation, it is not only one single state which can help in that. So it has to be a collaboration between the well-performing states and the states which are not so.
Now at present we have around 31 doctors. Out of 31 doctors from different districts. Different district means district where these FRU are located. So we have at present around 9 of them are undergoing Comprehensive Emergency and Obstetric Care. 9 of them are undergoing Life Saving Anaesthetic Skills, and 13 of them are doing training in ultrasounds.
So basically the training modes is that in the morning they describe what has to be seen and what are the findings they see, and as we teach them, they keep learning about the normal things that has to be done, the protocol and other things. In addition to that, we also give them hands-on training, and we assess how do they do, and how have they learned the techniques, and what are the basic things they will have to do.
I believe this is a great initiative taken up by the Meghalaya government. We have learned a lot during our theory classes. Practically, we're still learning, However, we've learned how to deliver normal deliveries, and then we've learned how to stitch episiotomy, and then we've learned how to assist CS cases.
Basically, we deal with the postgraduate students daily. So we learn certain things from them, especially if we ask questions, we always get a good feedback and a good response.
In order to learn, you need to get maximum exposure to these cases. See, you need to go and assess the cases, know how to do the operations. You need to observe. Then at the same time, you need to assess.
We really need such kind of courses to be done by the doctors, because we really had deficit of radiologists or sonologists in our state. So definitely by sending us medical and health officer like this, I believe that it will be a great help to our people.
All medical officers should have all these trainings so that they can do their the difficulty in access to the patients can be dealt with training all the medical officers, so that every woman has a positive birthing experience. This is what we aim to do in our hospital, and we feel that also should go to Meghalaya. So in a small way, we are happy that we are helping the state.
I think the first of its kind state-to-state partnership has been established, and we are very thankful to the Government of Tamil Nadu. They have immediately accepted our offer, and we could able to design this program. So in at least 10 community health centers and primary health centers, the pregnant mothers who really require the help, they can get the help. So this is a good example of collaborative governance, because we do have the problems and challenges. And with this support, again, with the support of technical support, with the kind of additional skills that actually our doctors are getting, I'm sure that we'll be able to reduce this maternal mortality and infant mortality to zero. So that's our very, very ambitious goal. But the idea is that no mother, no child should die because of lack of services. So that's the way, that's the goal with which actually the state is working, and we are very thankful for this kind of a support, because the support is very, very much needed.
Education actually will benefit more if it is disseminated to others, and there is no other better example than dissemination of the healthcare system education by our premier institutions of Tamil Nadu to all of you, the proud doctors of Meghalaya. This tradition will continue. We are very happy to train. Our Honorable Minister personally has taken care to ensure that they are all trained for 6 months.
மேகாலயாவும் தமிழ்நாடும் இன்றைக்கு நாம் இந்த மருத்துவத்துறையில் ஒரு மியூச்சுவல் அண்டர்ஸ்டாண்டிங் என்கின்ற வகையில் ஒரு புரிந்துணர்வு ஒப்பந்தத்தை ஏற்படுத்திக் கொள்ளலாம் என்கின்ற அந்த விஷயத்தை மரியாதைக்குரிய ராம்குமார் அவர்களும் அன்றைக்கினிய சம்பத்குமார் அவர்களும் சொன்னார்கள். சொன்னதோடு மட்டுமல்லாது ஏதோ அங்கே பேசினோம், கூடினோம், கலைந்தோம் என்றில்லாமல் உடனடியாக அவர்கள் சென்னைக்கும் வந்து இந்த புரிந்துணர்வு ஒப்பந்தத்தை போட்டு இன்றைக்கு அதன் மூலம் ஒரு 29 மருத்துவர்கள் பயிற்சி பெற்றிருக்கிறார்கள் என்கின்ற ஒரு மகிழ்ச்சியான விஷயம் இங்கே நமக்கு மிகப்பெரிய அளவிலான திருப்தி அளிக்கிறது.
We are so truly grateful to the government of Tamil Nadu for allowing the state of Meghalaya to send 29 doctors to come and expose themselves to the specialized training.
As far as I have seen, witnessed, like I have been doing USG here for the past 1 month. I finished 1 month actually. I've seen, I have done, actually today we completed more than 100 cases. So to see that I have done so much, it's like, it feels good actually that you are making a difference, because patients, they come and they are happy that we don't need to go there anymore, we don't need to go far anymore. Also, we don't need to spend even a single penny. We just have to come back to CHC and we just have to do. And yeah, I just know that I'm making a change actually.
Because earlier, how we used to manage USG was that we used to send our patients far off to two places where USG was easily available. One is Turas, Hawakana, and a private center, and another one is Jingjal Subdivision Hospital. But ever since USG has been started out here, we do not have to face the trouble of trying to convince people to go that far, because they are mostly unwilling to go that far. Now people come in group and they are ever willing to come and get themselves screened, and hence saving both the mother and the baby and preventing so many complications. Therefore, having an ultrasonologist as part of our team has added that extra component that we definitely needed.
This is Meghalayan CSC, which comes under the Ampati district, Southwest Garhwals. Here is under plain belt. So the patients are very huge amount. Ultrasound, so we used to send them, we don't have before here. Recently we got ultrasound, but before we used to send patient to Ampati. Last year, from our colleague Dr. Muktamiya, we went for in Chennai for ultrasonography, that's course training. So he's back now. He has already joined, and we have received that ultrasound machine also, and we have started also. We are getting nice response from the patients.
So from that beginning only, it was in my mind that one day if I get a chance, I'll do ultrasound. So luckily, our director, Madam, Joint Director, Madam Long, she called me and she said, Kim, you are ready, then I can suggest your name and you have to go Chennai for 6-month course. So I'm thankful to the government that they sent me for this course. They gave me this opportunity to serve my own people. Like this hospital covers around 36,000 populations, and this ultrasound is very helpful for the people also. We hope we'll try to do best.
Overall, it has been a beautiful journey for us, for me especially, and coming back here, even though it was a 6-month training, and though it was full with hectic work and all, I feel like I have gained so much of knowledge and experience on the field of anesthesia, and coming here, I feel blessed, and I feel much more equipped and much more ready to tackle the purpose that I have been selected for.
I would like to thank, our Honorable Chief Minister, the then Health Minister, the whole system in the state, our directors who were very proactive and getting this done and getting the ball rolling. Also thank even more the Government of Tamil Nadu, who were, even from the word go, they were ready and they signed an MOU at a very, very short notice, and they were fully forthcoming in helping, and they're monitoring it and they're helping us to coordinate. And most importantly, thanking all the medical officers who have taken this challenge and come as important representatives of this mission, who are taking this up and doing this course in Chennai. And it's a very long, tedious course. Long, tedious timings of the course for 6 months. So I'm very thankful to them also for taking this up, and we have a real diligent duty which I'm supposed to do for the people, and I hope we will be able to deliver.